Hi and welcome to Lead Well, the podcast for you if you want to get better at leading yourself and leading others. This is Christine Schickinger, your host, looking into how you can achieve peak performance while keeping a peaceful mind. In today's episode of Lead Well, we're diving into the fascinating world of mental health in the workplace with none other than Dr. Simon Senner. Simon started his career in Munich and Cape Town, where he specialized in psychiatry and psychotherapy. He quickly realized that to truly help individuals with mental stress, one must also analyze their working environment. At present, Simon is the chief physician at the Psychiatry Center in Reichenau, right by Lake Constance. But Simon's influence doesn't stop at clinical practice. He's deeply involved in consulting for top-tier companies, contributing to the advancement of telemedicine and shaping the future of mental health care through initiatives like Nilo.Health and brainswork.com. His workshops on mental health and healthy leadership have enlightened many, including not only participants in various companies, but also those of certification programs like the one at Technical University in Munich, and that's where we also met. Simon is driven by a concerning fact. Sick days for mental health reasons have shot up by 90%, that is 90% in the past 10 years. He aims to equip leaders with the tools they need to tackle the issue, turning mental health from a luxury into a key part of effective leadership. Get ready to be inspired by Simon's insights and experiences in this thought-provoking episode of Lead Well, where we explore how to foster a healthier, more resilient workplace. Welcome, Simon.
Thank you very much, Christine. Thank you very much for having me here.
Sure. Simon, in your biography, you mention an increase of sick days for mental health reasons by 90% over the past decade. What do you think is the reason for this increase?
Yeah, so first of all, the prevalence of mental health disorders is actually quite high in general in the population. So pretty much every second or every third German or European comes into a state once in his lifetime or even more often in his life where we speak of a mental health problem and a mental health disorder. So every second, every third gets, for example, an anxiety disorder, a depression, or another mental health disorder. And that is, on the one hand, already a really high prevalence. So every second, every third, if we count, each of us knows someone at the workplace or in his family that has troubles with his mental health. And then when we go to the workplace, there's actually really this increase of numbers of days absent. And that started around in the mid-90s. And since then, the numbers of days absent, they go only higher, higher, and higher. And it doubled or it tripled almost in the last 15 years. And that also leads, of course, to a certain point where companies say, okay, what can we do now? We have more and more of our employees that call in sick, that don't come to work because of not only physical diseases like we had it during COVID, where people were at home with a cough, with just feeling sick, but now as well with mental health problems. And as mental health is, of course, not only affected by our private influences, family influences, genetic influences that each one of us brings when we enter the world as a baby. Of course, later on, the way our work is organized, the way we work every day, 8, 9, 10 hours, of course, has or can have a positive influence on our mental health. So a work that we like, that we love going to work, that gives us a daily structure, that gives us positive feedback from colleagues, and that we enjoy doing, can also, of course, contribute in a positive way to our mental health. But of course, work that is not that well organized or not that well contributing on our health can also lead to higher absence rates. And this is something that is happening right now, that is still happening, and that is also increasing right now in the year 2023, 2024. It goes up again. So, and that here we come to a point where companies ask themselves, what can we do now? And is it also our responsibility to get active, or is that only something that affects the private life of my employee? And so doctors or psychotherapists have to care about it, but I'm not affected as a company. And that is the big question.
Oh, wow. Wow. So there was one thing that you said also in this program that we had, and that was really new to me, that the cost of presentism is actually higher than the cost of those being off sick. So would you want to share something about that as well?
Yeah, so when we have a look at statistics and see that more and more people can't come to work because they have a mental health problem, then that is already a big problem. Yeah. So, I mean, it's pretty easy. Someone doesn't come to work, cannot, for example, produce something with his hands. The company cannot sell that product. And so you have a loss of income for the company, of course. But then that is actually only the smaller problem, and that is called absenteeism. Absenteeism means someone is not able to work because he's sick. And that is the smaller problem in a relation of 1 to 2. And the much bigger problem is the effect of presentism. Presentism actually means someone is coming to work, he's showing up, yeah? He's coming there, maybe even in time, and he is there at the workplace, but he is not delivering his work as well as he could because he's, for example, he's got a depression at the moment. So, for example, when I have a depression, I, for example, cannot sleep that well. I was lying in my bed during the whole night. My thoughts are going in circles, and I can't really sleep. But nonetheless, I wake up and I go to work because I force myself to do so. But then, of course, if I haven't slept for the whole night, I cannot concentrate and I cannot do my work that well. For example, if you work in a bank and someone wants money from you, he wants to lend money, and he gives you a 40 pages Excel sheet where he exactly tells you how he is planning to pay back that money. Yeah. And you can't even concentrate on reading 2 sentences, then of course you will not be able to fully understand those 40 pages of Excel. And in the end, maybe you say, okay, he's a nice guy, I'll give him the 5 million euros. Yeah, he will most likely pay it back. But maybe after 2 or 3 years, he is not able to pay that money back. And that is because you have been showing you were going to work that day. You were not calling in sick. You were not staying in bed. You worked, but you didn't work properly. These costs that come up maybe sometimes even months or years later, this is the effect of presentism, and this is actually the much bigger cost factor for companies. So, for example, an engineer, who's engineering a car product, an engine, and then 3 years later, that engine has to get called back, and the costs actually coming from that goes into the millions or even higher amounts.
Yeah.
So that is the effect of presentism.
Wow, that's great. And it reminds me because I went through a burnout in 2015, and my listeners know that. And this is exactly what happened to me. I could no longer concentrate. And usually I'm really good at focusing. And at that time, I was all over the place, but not really able to focus. So when you think about the patients that come to your clinics, what is the condition that they're in when they're coming to see you?
Yeah, I mean, most often, like a lot of my patients, they come, of course, not only with burnout problems, with depressions, anxiety disorders, schizophrenia, whatever. But if, for example, people with a burnout or close to burnout state, they usually are quite impatient. They for example, they have read a book about a famous personality, a famous pop star, famous manager that writes about his, or that talks about openly about his burnout, and then they see those symptoms and say, hey, this is something I might also have. And they come to us and they say, okay, I've read this book here, and they also bring the book
Okay.
to the ambulance, and they say, okay, I think I have the same, and I'm really open for treatment right now, and I do everything you want me to do, but like next Wednesday I need to be fit again because there I have a really, really important appointment. So
Okay.
that is, of course, the first difficulty we have to overcome, to make sure that once you are burned out, that is nothing I can treat, or the best therapist in the world can treat in like 3, 4, 5, 6 days, or with a magic blue pill, and that all of this will disappear. But if you've taken too much energy out of your body, out of your system for months or years, yeah, no therapist will ever be able to treat that within only a short amount of time. Usually, treatment of those conditions takes a lot longer. I would say the average treatment time for burnout is something in between 3 or 5 months, sometimes half a year or even longer, a year plus. So the time being out of the job and being called in sick is actually really long. Yeah. And this is also why, like the term burnout, once you hear it for the first time, you think, okay, burnout, so that's someone who really burned, who worked a lot, and then couldn't cope it anymore, and he had a breakdown. So that sometimes sounds less tragic compared, for example, to a depression, a diagnosis of a depression. But actually, when we look at how long it takes to get fit again, for example, in a burnout, it's actually quite a long time. And I find it quite tragic, because it's got a lot to do with companies, or with a company's way of dealing with stress and putting stress on the employees. And so there's also, on the good side of things, there's also a certain factor of how to influence that in a positive way.
Okay, no, that's great. And what are you doing then to assist your patients? What type of treatments do you provide for them?
So we are trying to treat such a situation out of different points of view. So there is, of course, psychotherapy, so speech therapy. There sometimes you even need medication, so psychopharmacotherapy, and then a lot of other treatments come into place, like ergotherapy, sports therapy, group therapies, like a lot of different approaches. And usually, for example, learning social competencies is something that is quite important. For example, the social competency of saying no. Of if someone asks me, can you please help me here in my project? I can't cope it anymore. And you want to be a nice colleague, you want to please others, or you want to be like a nice person, a loved colleague. You will always say yes, 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 I'm helping you. But maybe that is also bringing you into trouble at a certain place. Or, for example, things like if you want to be always do everything perfect, that can bring you quite far in your career. But once you have a too high workload and you never learned how to stop doing things at maybe 80 or 90%, you want to do everything perfect 100%, and that costs you a lot or just too much time. And if that all ended up in being burned out, then you have to rethink on how to be a perfectionist in the future, or maybe change that. And that is quite hard. I mean, because, for example, even like being a perfectionist is quite a good thing in the working life, and brings you quite far on your career ladder. But if exactly that thing, that is something that brings you into trouble, and you have to change that, most of the time you can't change it by just reflecting for yourself and then change something on your own. This is, for example, something where a therapist, a doctor, a psychotherapist might be really helpful.
Oh, that's great. And that also reminds me, because when I look at my clients that I work with as a coach, I have noticed that the workload is getting higher and higher. In earlier times, I mean, when I was young and I started working, I could finish my work on a Friday evening. But nowadays, I think that's no longer possible. That probably brings us to the next part, talking about, well, what can the company do? What can a leader do to actually make sure that the team is staying healthy and will stay productive? Because I think if they are, we've heard, if they are not healthy, they cannot be productive in the long run. This was the first part of my interview with Dr. Simon Senner, and I look forward to sharing with you the second part next week. Until then, may you always lead well, yourself and others. This was Lead Well. Now, what is the one thing that you're taking away from this episode? Please share in the comments below, and do share the podcast with your friends and family, but only if you like it.